$2 billion. That's how much the provinces and the territories will get to deal with medical backlogs created by the COVID-19 pandemic. The federal government provided a similar top-up last year, but how much of a difference will today's $2 billion commitment make? Health Minister Jean-Yves Duclos is here. Minister Duclos, thanks for coming in.
Good evening, David. Good evening, everyone.
I'd like to start with the money, if I could. In the last election, you were promised $6 billion to clear up backlogs. Today's announcement was $2 billion. Is there more coming, or is this it?
You're correct. Now, we announced $2 billion today. We had already announced and implemented $4 billion last March, in March 2021. And we know now the needs are significant, and that's why we think and believe that these resources will be very helpful in reducing the backlogs, about which I spoke many times with my colleagues, health ministers across Canada.
Right, but the promise was $6 billion over and above the $4 billion from a year ago. So is this $2 billion start of that, or are we not going to see the rest of that $6?
Again, you're correct. The platform is more ambitious, but we are at the very start of a mandate, so we look forward to doing more.
Okay, so $2 billion obviously now will help, but it's not going to solve the entire problem. How much money do you think it will require to help deal with the surgical backlogs that exist in the system because of COVID?
There are about 700,000 surgeries backlogged, either because of delays or being canceled, so that's a large number. But we think that the $2 billion investment, very short-term, very quick, will help. I've had exchanges with my colleagues, health ministers across Canada. They are, I think, going to be grateful for that support, and they will be able to do the hard work that we now need to do to find the healthcare workers, resources to look after those whose surgeries have been delayed.
Okay, so the speech you gave today, you outlined 5 priorities essentially for these upcoming health transfer negotiations, let's call them that. And the provinces might look at these 5 categories and say, that sounds a lot like money, but with strings attached. And you know that this is something they do not want. Is that what these 5 priorities are conditions and strings for any future money?
No, these are not the conditions. These are common areas of priorities. If you had listened like I did to my colleagues, health ministers, if you listen as you always often do to experts, healthcare workers across Canada, these are not exhaustive, but they're very broad and supported areas of priorities dealing with backlog, healthcare workers, family health services, long-term care, home care, mental health services, substance use services, and access to virtual care and the use of data for personal and clinical purposes.
But you know Premier Legault, you've talked to the guy, you know he doesn't want to hear any sort of federal parameters on what future transfers should be spent on. I know these may be areas of common interest, but when you spell out the 5 things that you want to fund, if those don't 100% align with the provinces, that could set the stage for some tension in the talks, could it not?
Yeah, I call that the triple R rule. Respect, responsibility, and results. Respect for jurisdiction. It's important for a federal health minister, it's important for a federal government always to state clearly that we need to respect provincial jurisdictions in health. No one should believe or hear that the federal government is going to micromanage the healthcare system of any province, including Quebec. However, we do have a shared responsibility. If we didn't have a shared responsibility, the federal government wouldn't be there to provide that type of support that we announced today. Finally, we all want to focus on results. The third R is results. All of my colleagues, health ministers, want to do that. Now, billions of dollars, percentage points, these mean very little to most Canadians. What means something to Canadians and for Canadians that need healthcare is results. Now, how much time do I need to wait for a surgery, a hip replacement? Whether I am able to access a family health doctor, whether my grandparent or my parent is going to be able to live safely and in dignity in a long-term care center, and so on.
Right, but so you've announced the $2 billion today. We've got a budget coming in the next couple of weeks, certainly within the next month. I mean, you're laying out this sort of opening position with the 5 priorities right now. I mean, there's not going to be enough time to see a substantive investment. Not that $2 billion isn't substantive, but we're talking much larger amounts in terms of what the provinces are looking for. We're not going to have time to see something like that in the upcoming budget, are we? This is a longer-term play you're outlining here.
That's correct. And it's not only a longer-term plan, it's a plan which builds on the very successful relationship we've had in the last 2 years. Let's remember that in addition to the Canada Health Transfer, the $45 billion health transfer, there has been a $63 additional billion invested in health and the safety of Canadians in large part through supporting provinces and territories. Other resources, three important investments for which we are hoping to negotiate new agreements on mental care, on home care, and on long-term care. These dollars exist, and we are looking forward to negotiate agreements on them. Plus, I could mention the virtual care investments. I could mention the investments in vaccine passports and many more things that are part of this path towards the future.
Right, and all of those things are in the 5 priorities you sort of outlined today, but what's not there is dental care and pharmacare. So where does that fit into this, given that you've just cut a deal with the New Democrats and moving on dental right away and pharmacare within the next year is part of that arrangement?
Yeah, it's important to be mindful of that. Now, we did sign an agreement with the NDP on Monday. That's great news for Canadians. It's going to make us better able, at least make Parliament better able to focus on the healthcare needs of Canadians.
But are they priorities 6 and 7? Should we stick those on to the 5 you've outlined here?
Dental care, pharmacare, in large part to reduce the cost of medicines, all going to be parts of the common agenda with the NDP. I spoke to Don Davies just a moment ago. We've exchanged over the last, it happens to be the NDP critique of health. We'll be working together as we also work with stakeholders and partners and provinces and territories in advancing those other parts of our joint mandate.
Just one last priority I'd like to focus on with you that you've mentioned, and that's the recruitment and retention of healthcare workers, right? And we have seen the strain, the burnout, the harassment, and the exodus of people in that profession throughout the pandemic. What's the solution there? I mean, how do you target that and solve that problem to get the abundance of healthcare workers that you're going to need to hit your targets here?
You're completely right to insist on healthcare workers. In order to care for patients, we need to care for healthcare workers. They've been exhausted. As you said, they left in large numbers because of COVID-19. Many more of them, unfortunately, think of leaving or retiring in the next few months. We need them if we can look after the needs of many patients who either have suffered during COVID-19 or would need regular care, obviously. So thinking of the healthcare system obviously necessarily needs thinking about how we send support, as you said, train, hire, retain, providing working conditions that are safe to them as well. If we want for healthcare workers to provide safe care to patients, we need to provide them with a safe environment, looking after their mental health, which has deteriorated significantly over COVID-19. It's a very key element of our common priorities with provinces and territories.
Okay, Minister Duclos, thanks for coming in today.
Thank you, David.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.